Hi, today we're talking about how important CLABSI ratings are, and we're also going to be highlighting how amazing pediatric home service stacks up to the nation. According to published CLABSI rates and CDC records, pediatric home service leads the nation in keeping patients free from central line infection. Pediatric home service CLABSI rate is 0.49. Infusion patients have to take great care of their central lines in the hospital and at home so they avoid central line associated bloodstream infections, also known as CLABSI. At pediatric home service, we have a consistently low CLABSI rating, that 0.49 rate, when compared to hospitals and CDC's national rate. The CDC national rate of 0.86 is quite a bit higher than the pediatric home service rate, which is 0.49, which means we help our patients and caregivers by providing the best care possible for their central line care, keeping them safe and in the comfort of their own home while they recover. Okay, a few stats on infusion, just so you can understand why CLABSI rates would be so important. What is infusion? It's medication that's delivered through a line. That could be through a needle or a catheter. It's generally done intravenously, and some drugs are definitely more effective through infusion. And infusion can be done in the hospital, in a clinic, in an infusion clinic, or at home. Types of infusions include antibiotics, total parenteral nutrition, a myriad of other drugs that can treat chronic illnesses. And then, of course, you can always do vitamins and hydration, and there's many more opportunities to infuse something, but generally vitamins and hydration aren't really done from the hospital. The cost varies wildly, possibly $100 to $2,500 a day, just depending on what the drug is. And honestly, it could get more than $2,500 a day, just depending on the drug. I've seen some crazy things. I've seen some drugs that literally cost $100,000. Insurance sometimes pay for it, sometimes they don't. Who prescribes this? A medical doctor or a nurse practitioner. Sometimes this can be done from a clinic, but generally it's done from the hospital on a discharge. Clinic sometimes, but mostly from the hospital. So why are CLABSI rates important? A CLABSI is central line associated bloodstream infection. I know that's a mouthful, but as I was saying, it comes from it can happen from being infused. So why is it so important? Keeping the patient safe. Number one, keeping the patient safe, because you always want to keep the patient safe and free from infection. You also want to keep them in a place where they're comfortable. This could be inpatient sometimes or at home. Another huge important reason is because of the cost. On average, it costs $46,000 to treat a case once it happens. And that's $46,000 is a lot. That's not a year. That's per case. Once you get an infection, the average cost to become infection-free is $46,000, assuming that you do survive that, because 12 to 25% of patients do pass away because their infections become that bad. It also, you can incur longer stays in the ICU once you have an infection. So there's a lot of reasons. Those are the big reasons, but there are many other reasons, obviously, to not catch a CLABSI. I also want to point out that on the bottom of this chart down here, you can see where I've circled 250,000 CLABSI cases occur each year, and of those 250,000, 80,000 of them are from the ICU. So I think there could be a case to be made for patients to receive their care at home, if it's possible. It's not always possible, but if it is possible, they might have better outcomes. What are the top performers saying? Well, Texas Children's is saying that their CLABSI ratings do matter because their prices are upwards of $55,000, and also adding 19 days per case. So that's even bigger than what the national prices were from the NIH. UPMC in Pittsburgh, they're saying that their CLABSI ratings in their PICU are at 4.0, and that in their NICU they are 3.0. And then what is pediatric home service saying? Well, we're still saying that our rate is 0.49. And we're also going to add to that our patients are chronically ill and they receive complex catheter treatments on a regular basis. These patients are very complex. They have lots of RT equipment, and they possibly have GI enteral feedings. They have many other pieces of equipment in their home that could make this a much tougher situation for them, but somehow we still keep their CLABSI ratings low. National and top performer rates. As you can see here, Boston and Texas Children's rates are ranging between 1 to the 1.2 range. I mean, that's just a little bit higher than the national. UPMC in Pittsburgh, they're high. They're at 4.0. But the national rate for the CDC, with roughly 500 facilities, they're sitting at a range of 0.86, a rate rather, not a range, a 0.86 rate, which is not bad at all when you're thinking about the nation, and you're also looking at different types of facilities. So the 0.86 rate really isn't terrible, but it's still not as good as pediatric home service, who is still sitting at a 0.49 CLABSI rate, which is actually, well, let's see, there it is. It's still consistently lower than everybody else's, and 0.86 is nearly double of that. So they're still staying in a really good spot. When we're looking at our 0.49 rate for pediatric home service, I think it's very important for us to say why, how we came to this number, because that's an important piece. We measured this on line infections per 1,000 catheters a day, 1,000 catheter days. Sorry, excuse me. So every 1,000 catheter days is how we measured this and came to a 0.49 CLABSI rating. I believe that's how they do it nationally as well, but I wanted to let you know that that's how we rated ours. It's also on this chart, you can see that we went up a little bit to 4.49 from the end of just 2022 to 2023, but it will be worth noting that our census also went up drastically from 22 to 23. We grew tremendously in the last quarter to the first quarter. So that would have made more patients, which would have made more opportunity for something new. Okay, so what does that say about pediatric home service and home infusion? Well, patients can be infused in the comfort of their own home. The cost is going to be lower to the facility because the facilities had an opportunity to discharge them. Most insurances cover this. The only insurance that I've seen that hasn't covered it is marketplace plans. Everything else pretty much covers it. Commercial insurance policies give you an opportunity to have to pay an out-of-pocket, but all in all, most insurances cover it. It reduces hospital readmission rates for facilities because, again, with that 0.49 rate, we are keeping our patients clean and at home, so they're not being readmitted to the facility. Our skilled nurses are there to oversee and educate all the line care, including dressing changes, keeping the patient well informed on CLABSI, probably talking to them about that 0.49 rate, the importance of keeping lines clean, and the importance of a sterile area. And patients overall get to stay home in an environment they are comfortable in while receiving their infusion, knowing that they are with a company who is dedicated to making their infusion a success and keeping them clean and CLABSI free.